Hello, everyone, and welcome to the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
Welcome back to the program. This is Aebhric. This week we are with Angela Jedlicka, who is the Registrar of the college. She's been working in a very remote environment as a nurse. Angela, welcome to our program.
Thank you, Aebhric. Thank you so much.
I've been dying to get you on here because you've been part of the college for almost a year now, haven't you?
Yes, I think it was April of 2023 when John asked me to do this role. And I was like, yeah, I'll do it. I am not sure what you want me to do, but I will give it a college try. And here I am a year later.
How are you getting on?
Oh, good. It has been a bit of a learning curve for every one of us, I think. I didn't realize what the role entailed when I started. And so as I have progressed through this year, I've learned that it's a full-time job. It really is. It's a job that it takes a lot of time and a lot of patience and a lot of uh, technology that I sometimes struggle with, but I'm doing my best.
Since this is the first time on the podcast for you, tell us a bit about yourself and what keeps you busy.
Well, currently I work in the United States as a registered nurse in an emergency department, and I had been for the last year and a half on the Navajo Indian Reservation in the New Mexico, Arizona area. And I moved home last week, actually this week, and I'm going to start a new job in a critical access hospital in a little teeny tiny town in south central Iowa. It's a 16-bed hospital. 4 of the beds are going to be the emergency department, and there's 3 nurses that work on my shift, and I'm going to be the only nurse in the ER, so this is going to be a new adventure for me.
Wow.
Yeah.
So you do like the remote environments, don't you?
I have learned to embrace it. Yes, it is. When I worked as a flight nurse, I went to get a kid who had been involved in a house fire. And it was he, his sister, his mom, and his dad. His mom and dad were injured to the point where they had passed away. And so we scooped up this kid, flew him to a big city hospital, a pediatric hospital, and there were more people waiting for us in the trauma bay to accept this kid than were in the entire hospital that we had picked him up from.
Wow.
And as a big city hospital, you kind of get this persona that we're bigger, we're better, we're stronger, we're faster, we jump higher, we play harder, that kind of thing. And they were kind of being ugly about what had happened to this kid at this little hospital. And finally, I'm like, you know what? There are more of you standing here waiting to get this kid than were in the entire hospital where we picked him up from. And everybody in that hospital knows this family.
Hmm.
Don't yell at them. Don't disparage them. They did the best they could with what they had.
Yeah.
And they had 3 other people besides just this little guy.
Wow.
So let's be adults. Let's take care of this baby.
That's part of austere medicine, isn't it?
It is. And you sometimes have to tell people, you know what? Yeah, yes, you are a tertiary care facility, and I appreciate that. But let's appreciate what they came from and what they did to get them to you so that you can do the care that you can provide. Let's be kind, let's be gracious, let's be gentle. And I think sometimes that gets lost.
That's part of the draw for these very remote and quiet neighborhoods and tiny hospitals, because everyone knows everyone, and everyone comes together as a group. And there's something. I grew up in a super small town in the Pacific Northwest, and everyone did know everyone. And we had a hospital there that my mom worked at, and it's a really close knit community. So you were at Soma, and this is the first time you've been at Soma. And tell us about that. How was that for you, and what was your experience?
I have been to a lot of conferences that are geared towards aeromedical or critical care transport environments, but I had never been to a conference that was geared mostly towards special operations kind of things. I got mammed a lot.
Yeah.
And I'm like, well, that's not so bad. It's not so bad. There was a lot of people there that have backgrounds that I am not familiar with because I have never been in the military, and I've always been civilian based stuff. I've never really had anything to do with the military, so it was a bit of a learning experience for me. It was a good experience. I got to meet a lot of people that I know I would never meet in my normal everyday life. Part of the CoROM group, um, I think it gives us the opportunity to share what we are bringing to help people expand their knowledge or their education. And I think there's a lot of need out there for that, particularly in the austere medicine environment. And that's what these special operations people do. I mean, they can be out in the middle of nowhere with nothing besides their backpack and what they can carry in their pockets.
The challenge of providing evidence-based medicine with only a rucksack full of kit. That's fascinating for me to see what people
Yes.
can do. Yeah.
Yes. The things you can do with the stuff that you can find in your backpack.
Hmm.
Uh-huh.
And to be fair, the whole MAM thing. I mean, Dr. Ella was right next to you, and she got mammed a lot as well. So
She did.
it's just kind of the normal thing, I think.
Yes, I mean it was a bit refreshing. Honestly, it was a bit refreshing. Yes.
It is definitely one of my favorite weeks in my calendar each year,
Mhm.
and it's every year is a bit different. Every year is you're meeting people you'd never meet before, and
Right.
sometimes over the years you see the same people again and again there that just come to the Soma. You're like, hey,
Right.
I saw you last year at Soma, and that's the only thing you say to them.
Uh,
The next Soma comes
remember-
like, hey,
yeah,
I saw you at Soma.
right.
Uh, uh,
Remember you from last year. Yeah.
yeah. So tell us about the registrar job. So what is your job? What do you do? And what are some of the fun things that you like about it?
What I do is when prospective students apply to the college, I look at their application, make sure all their little ducks are in order, and then I pass it on to the program manager, whether it be the short course program manager or the bachelor's program or the master's. And currently, for the master's students, I'm doing their interview process. Well, face to face over Zoom,
Nice.
um, and to make sure that they understand what the challenges might be. And then I also feel like it's a good thing to have a face with a name so that if people run into problems or hiccups, they can send me an email and I can, oh, you know what? I don't know the answer to that, or I do know the answer to that. This is how you navigate this. Or sometimes I don't know the answer and I'll be like, you know what? I don't know the answer to that, but I know who I can find out for you. And I think just having a face with a name leads credence to people being able to navigate the system a little bit easier.
Hmm.
That way they could just say, you know what, I don't understand this. Can you help me? Yes, yes, I can. And for me, that as a person who has gone through a lot of post secondary education, just having somebody that you can contact that will actually answer you is huge,
Hmm.
huge. Yeah, because when I went to my master's program, yes, there were people that I could contact, but sometimes it'd be a week or two or three before anybody would answer me, and I'd be like hanging along, and yeah, a little bit of a struggle. So just having somebody that you can email and somebody that is receptive and will be responsive and get back to you, I think is
Hmm.
is
One of my favorite jobs when I was running the college was the face-to-face interviews, and you get to see the light in their eyes as they're talking to you, and like, oh, I'm so excited about doing this program, and this is why I want to do it, and you get to see the human side of the academia, and I miss that. I'll be very honest, and I'm glad that you picked up that torch, and now you get to meet all these bright-eyed, bushy-tailed younguns who are who are coming through the program, and it's
right.
it's always interesting to hear their stories and where they're coming from and why they're doing it.
Yes, and it to help them navigate their work-life balance, because going to school is, it takes a lot of your time. Honestly, it does. And when you go into it, you think, oh, I can navigate 4 or 5 hours a week to dedicate to this. And sometimes it's less, sometimes it's more, but putting that seed in their head saying, sometimes it may be a bit more of a challenge for you for your work life balance. I think lets them think through it and make sure that this is something that they can absorb into what's going on in their lives, because everybody has work and home and kids and all that other stuff. And I think going to school just adds one more layer of responsibility, and I got to get this done. So just making sure everybody knows going into it that it's going to be a little bit of a challenge initially, but then you work your way into it and you figure out, oh, okay, I have to do this today. I have to get this done. So,
I remember a few of the interviews I did for especially the bachelor's program, where after talking to them for a while, we both agreed that it wasn't a good fit, and
mhm,
they didn't enroll, and that was the best. It wasn't great for the college because we lost out on tuition, but it was the best option for them. And I I'm not a businessman. That's definitely not good business to talk people out of it. But then finding the the, the history of the person, their needs, and
mhm.
meeting that regardless of if it's in the college or not. And that's I miss that interaction.
Yes, I think when people initially apply to go to school, they understand the platform of it, but sometimes I think that they don't understand the time that goes
Mm-hmm.
into it. And when you have a full-time job and you have a family and you have all this other stuff that's pulling in three different directions, sometimes just having the time to dedicate to your studies is more of a challenge than people really understand. And so I try to help people envision what their life will be while they're trying to do all this stuff all at the same time.
Design the bachelor's and master's program with the student in mind. So if they enroll and they're like, this is taking way too much time, instead of exiting and getting just college credit, they're exiting and getting a diploma or getting a postgraduate certificate. And because they don't understand the massive amount of work and time. So they go through it like the master's program. They're like, I just can't. I've done two modules. And you talk to them like, look, you do one more and you get a PG cert out of it, and it gives them a piece of paper on the wall anyway. So it's I, people don't understand. I think the massive amount of work, and the thing is, we're tailoring everything for the person working. Like no
Hmm.
one stops work, and well, we've had a few that did it full time, but most people are balancing, the personal life, their marriage, their family, their kids, and work.
Hmm.
And yeah, so that's a challenge to add one more stressor to it, and
Right.
you get to talk to them and sort all that out.
Hmm. Or
Yeah.
give them an ear that listens and says, I get it. I understand it because I finished my bachelor's online. I did my master's online, and I'm part of the PhD program with CoROM right now. And do I sometimes procrastinate? Absolutely, I do. I have an assignment that's due today. Have I procrastinated? Absolutely, I have procrastinated, but it's my fault. And I will work my way through it and I will get it done and I will get it turned in. And you just learn to accommodate yourself so that you can get your job at work, so that you can get everything accomplished that's on your plate.
Well, you have one heck of an excuse. You're talking to the dean emeritus, and this has taken my time today, and I'm not, not working on my thesis at all. Um,
That's all
but,
right.
so you've been here for a year and change. What is your long term goal, or what would you like to see the college do with your department, or where would you like to go within the college?
I am very thankful that the college is geared mostly towards pre-hospital or paramedic people in the paramedic role. And everybody at the college has embraced me in my nursiness, and they have embraced me being a nurse, which is a different. We have a different way of looking at things than paramedics do, and I'm very thankful that everybody at the college has embraced me. I'm very thankful for that. I am getting to the point where I don't know if I'm aging out of bedside nursing. I think I'm getting to
Mm.
the point where, you know what, I'm getting kind of old. And so I think once I finish my doctorate, I will be looking towards doing something besides being a bedside nurse. I'm
Mm.
just not sure what that will be. But I also want to continue to work for CoROM because it gives me the opportunity to see how things work in the rest of the world besides just our egocentric Americanism.
Mm.
Healthcare in the United States is far different than in the European Union, or
Indeed.
some of my cohorts in my PhD program are from Africa. And so their healthcare is so much different than what we have here in the States. And so just having that, just uh, being able to understand how they do healthcare and then sharing with them what we do over here has been an eye-opening experience for me as well.
Mm.
Because as you know, Eric or Aebhric, coming from the States, going to Europe, and then coming back and forth, you're like, oh my, how do you not do well? That's how we do it here. So here we
Mm.
are.
Yeah. So here in Europe and Africa and other places, the nursing world is strong, like it is in the States as well. But when it comes to paramedics, there's inequality that we don't see in the States. So, for example, in England, it's a bachelor's degree nurse and it's a bachelor's degree paramedic, and
Mm-hmm.
then they work for a bit, and then they can both apply for the same master's degree or
Uh,
advanced clinical practice, and then they're on the same rank as a junior doctor. Some doctor, like they graduate medical school and they do the first year. I think the Americans call it intern. So these nurses and paramedics of the master's degree are on the same rota as the junior doctors. And so and the doctors are equal as well because it's a bachelor's degree of medicine, bachelor's degree of nursing, bachelor's degree of paramedic. So I think that's partly what you see when you join the quorum, that there is more of a equality and brotherhood, sisterhood within the college that is a little different than the hierarchical system in the States.
oh, it's way different, much, much, much different. So, in my previous life, when I was a flight nurse, I always had a paramedic partner, and we were more of an equal partnership than if you work with a paramedic in the emergency department, because there's some things that he or she is unable to do based on their scope of practice. But with being a flight person, they can do more. But it's very different seeing somebody who has a different education apply it apply it to take care of patients, because like for me as a nurse, I'm better at the ICU stuff. I'm better at the this is what we need to do post intubation. And my paramedic partner was always like, well, this is what we're going to do before. Okay. And then we come together and make a plan. And the combination of the two educations worked so well to provide great care for people that were very, very sick.
It's a it's a perfect match, isn't it? And if
Yes.
you look at the Australians, they have a 4-year bachelor's degree that confers a nursing license and a paramedic license. So
Oh,
they've matched it. Is
oh,
that
that's
something we
very,
should do?
uh-huh. But I know how the nurses would embrace that.
Yes,
It
the
would be
nurses
more
in
of
the
a struggle.
states,
Yes.
but
Yes.
what it so what would happen? So in the U.S. there isn't even a degree for the paramedics, and the nurses are an ADN, so it's a 2-year degree with a 1-year prep a 3-year degree, which is a bachelor's degree, isn't it? So is
Uh,
it?
well, here in the States, we can do an associate's degree program or a bachelor's program. I'm old school, and so I went to a diploma program that was a hospital-based nursing education program, and they don't even exist anymore. And for me, that's a sad, sad situation because as a diploma grad, um, I knew how to take care of patients when I got my first job. As a bachelor's prepared nurse, that wasn't always the case. They don't always have the opportunity to do a lot of clinical experience. They do clinical things, but they don't have the amount of clinical time that diploma nurses did.
Hmm,
And so there was a little bit of a disparity when you first started in your new role as a graduate nurse, and now they don't even have diploma nurses anymore. It's either an associate's degree or a baccalaureate, and
yeah.
that's a little sad to me. But
There's a difference in the nursing training. So here in the EU, the 3-year degree program, half of it must be clinical.
yeah,
So 4,500 hours for a 3-year degree program, half of that must be 2,300 hours of clinical time as a nurse. And in the States, I've seen bachelor or masters of nursing. If you can have like my bachelor's is in liberal studies, it's the most bollocks bachelor's degree you can think of. But I can enroll into an MSN program as nursing. And in 2 years, not only do I have my bachelor's in nursing, I also have my master's of nursing. So there's no way that they can get 2,300 hours of clinical time in the nursing program in the States.
nope, there's no way. Yeah, and that's unfortunate.
Hmm.
It is.
So it's a lot of clinical time here, but there's not as much skills. So you're allowed to do way more as a nurse in the U.S. than you can do. You can push more drugs. You can do more skills. You have more autonomy as a nurse, whereas
Mhm.
nurses here don't quite have that outside of the UK, I think. But so there's pros and cons.
Yes, and as a pre-hospital flight nurse, we had a lot of autonomy.
Mm,
As a bedside nurse, we don't have as much autonomy, but once people understand what you have done previously, um, they are more willing to listen. And for instance, when I come out of a room and I go to the physician who's taking care of the patient and say, you know what, I don't know what's wrong with this person, but I don't like it. I think that peaks in their head. They're like, oh, she's an old chick and she's been around the block a couple or three times and she might know a couple or three things. So perhaps I should listen to her and go see what's wrong with this patient. Because yeah, I don't know how many times I've walked out of a room going, I don't know, something just isn't quite right.
mm.
Mm-hmm.
And that
Mm-hmm.
comes with clinical experience. After
Yes.
seeing thousands and thousands and thousands of
Mm-hmm.
unwell people. Mm.
Mm-hmm. Mm-hmm. So going back to your previous question, what do I want to do? I don't know. I haven't decided yet. I don't know. I don't know. I like where I am now. I like having the ability to toggle between my academic world and my clinical world. I kind of like that. I
Mm.
think somewhere along the way, I will have to focus more towards my academic stuff rather than my clinical stuff because I think this job is going to grow as the school grows and it will take more of my time. And so I'm going to have to budget my time a little bit better.
Mm.
And you know what, Malta, really? It's lovely in Malta.
It really is. I'm there now. It's quite
Lovely in
quite
Malta.
amazing. Yeah,
Yeah.
there's worse places to be.
Oh, there are way worse. Oh, trust me, there are way worse. There are way worse places to be. And when I went to Malta for the Medicine in the Mediterranean conference, I came home and I was talking to my family. I'm like, oh, it's so nice there, and they speak English. Yay! And they eat food I can recognize. Yay!
Yeah, yeah. Well, yeah. You found a home within the college and a home within Pretty Bay, Malta.
Yes, yes, it was lovely.
Nice. So, for people who are interested in applying to the college, what advice do you have for them?
My best advice is to look at the website and see if anything interests you. If it does, either send an email to the info email address, and you will get an answer, or they can email me directly, which would be fine with me as well. I don't think my email address is necessarily on the CoROM website at this point, but just explore through the website and see what you like. And if you have questions, give us, send us an email. We'll answer you. I think it's the school right now is small enough that there's more personalized interaction with everybody at the school. If it were a bigger place, I think that might get lost a little bit. But I think at this point, it's small enough that we can still be personally connected with the students. And I think that's very helpful as they progress through their education.
I do hope that as we grow, we keep that small town attitude
I
that
hope so
we
too.
like. Yeah.
I hope so too. I hope so too.
So, Angela, my final question is this. What advice do you have for the new nurse, new paramedic, new junior doctor who's starting out in the world in medicine?
Have you seen the musical Hamilton?
I have seen YouTube clips of it.
Okay, so there's a thing in Hamilton where the advice given to the main character is smile more, talk less. Listen. Listen to what people who have been doing this for a while have to tell you. Coming out of school, you're bright eyed and you're bushy tailed, and I know everything, and I blah, blah, that kind of a thing. But sometimes just listening to what people have to say will influence you to do a better job. And I have a nurse in, I worked with a nurse for a very long time in an emergency department here in Omaha, and her name is Irina. And Irina will always be the voice in my head that makes me do better. Everybody should have that voice.
Mm.
She will always be the voice in my head that makes me do better.
It's always good to have a voice or a little person on your shoulder saying, be better.
Yes. And she was, I worked with Irina for like 17 years. We worked together for a long time. I think one time I saw Irina kind of have a little bit of a meltdown and kind of get a little sideways. But most of the time she was like, you know what? We're here to do a job. We're here to take care of people. Getting upset and aggravated isn't going to help it. So let's just get it done. And that for me has got me farther in my career than anything else. Like I said, she will always be the voice in my head that makes me do better.
Angela, thank you for your words of wisdom. Thank you for joining our family. And you are making the world a better place.
I'm trying one voice at a time.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at corom.edu.mt.